I have seen a major shift in the patients who come into us for spine problems. Earlier, we would get most patients above the age of 50 with what we call as degenerative spines. However, now there has been a big shift in the age of the patient that walks into our clinics with any kind of pain in the spine, which could be back pain, middle back pain or lower back pain. Very, very young patients are now walking into the clinics. Our average patient who has a spine problem, averagely they fall into the age category of around 25 to 30 to 35. And it's very, very alarming to us that why so many youngsters are coming to us with back pain or neck pain. And majority of them, frankly, have already damaged the disc of their spine. Obviously, there is a reason, is the lifestyle. And a physical therapist's role and responsibility hence also becomes more dynamic, and we really have to take responsibility to help our youngsters to come out of these problems in the fastest possible way. Now, when we say the spine, why do you think the spine is now having a lot of problems? The human spine was never designed to sit in one place. We were designed to walk, stand, run, jump, hunt in the jungle, be in the farms, do a lot of work where we are moving the body. In today's modern lifestyle, we have now become a society of sitters. We sit at work, we sit while we travel, we sit at home for our TV, we sit at home during our leisure activities like going for a movie. We are sitting way too much. Secondly is obviously the advent of all the gadgets, the iPads, the tablets, the mobiles, the laptops, and the number of hours that we are spending on these gadgets has created a lot of stress in our spines, and people walk into our clinics. 60% of the patients who walk into our clinics are with neck and back problems, and they're just growing in an alarming way. Now, how does a physiotherapist really help out? Number one, if someone approaches us before they've had a back problem, it's the best time. Alright? They know that their job requires them to sit long periods of time, or the sports that they play is going to have a huge influence on their back. When they approach us, we look at the preventive management. Number two, we look at obviously the acute injury management, which is to basically reduce the stress on their spine, give them some self-management techniques at home so that they are able to take care of their problem. It could be a change in mattress, it could be the way they sleep, it could be the pillow that they are using. Simple changes in their homes or in their office space that can influence their back management. Number three, we look into their posture and their body alignment. Are they somebody who is having something known as scoliosis, which is a lateral deviation or a side deviation of your spine where the person looks slightly crooked? You could be somebody who has a very large belly, which then puts a lot of influence on the lower back. For every 1 kilo gain in your abdominal girth, it increases the stress on your back by 5 kilos. So for every 1 kg weight gain, you're actually influencing your spine by another 5 kgs. Hence, the weight loss program is extremely important, and a physical therapist will not just look at your back issue, but will also help you in prevention, helping you reduce your weight so that you are able to not get any kind of relapses in your spine. The other thing I think a physiotherapist very importantly helps you is to get back to the activity that you wish to do. You get pain-free, but you want to be pain-free so that you can travel, so that you can trek, you can go for a picnic, you can go dancing. Ladies come to us saying, I want to wear high heels. Some of them tell us that we have very heavy bags to carry when we are traveling, as a result of which their spine should be pain-free in higher levels of activity, which is what we call as advanced rehabilitation program, which is obviously more equipment-based, more challenging. Because you do it under the supervision of a physical therapist, it automatically is a safer environment for you because your program is designed as per your medical diagnosis.